Today we will study about the fibula bone. Okay, so this is the fibula. I'm doing it again. So this is the fibula bone. In the fibula, we have three features. This is the head of the fibula, this is the shaft of the fibula, and this is the lower end of the fibula. Okay, the fibula is a long and thin bone, and it forms the lateral part of our leg. And the fibula bone is homologous to the ulna of the upper limb. So it has three features: the head, the shaft, and the lateral part. The lower part. The head of the fibula. In the head of the fibula, the head of the fibula is extended anteroposteriorly. If we observe the fibula, then we will find out that the styloid process or the apex of the fibula, that is pointed, that is the most upper part of the bone, this apex or the styloid process, it forms the posterior part of the head. Okay, so this is the styloid process. This styloid process, it forms the posterior part of the head. Okay, then just opposite to the styloid process will be the anterior part of the head. If we look at the head of the fibula, at the center of the head, the medial part of the head, the center of the head is flattened. It is a flat surface in the center of the head. Now, the lower part. The lower part of the fibula bone, it forms the lateral malleolus of our lower limb. This is the lateral malleolus. The lateral malleolus, and this is the lateral surface of the lateral malleolus. The lateral surface of the lateral malleolus is always subcutaneous. This is the medial surface of the lateral malleolus. The medial surface of the lateral malleolus, it articulates with the lateral part of the tibia bone. It articulates with the lateral part of the lower end of the tibia bone. Okay. Then in the lateral malleolus, there is one more feature present, and that is known as the malleolar fossa. This is the malleolar fossa, and the malleolar fossa, it forms the posterior part of the lateral malleolus. Now the shaft. The shaft of the fibula have three borders and three surfaces: the anterior border, the middle or the interosseous border, and the posterior border. The anterior and the middle border, they both origin from the anterior aspect of the head. In the upper 1/4 of the bone, the anterior and the middle border are completely indistinguishable, because there is, in the upper 1/4 of the bone, the anterior and the medial border, they both are completely indistinguishable. You can't distinguish that which is the anterior border and which is the medial border. Okay, the anterior and the medial border, they both gets origin from the anterior part of the head. And while running downwards, we can distinguish the anterior and the medial border. On running downwards, the anterior border, before the anterior border gets terminated with the lateral malleolus, it gets divided into two parts and forms an elongated triangular area. You got it now? And the medial border, this is the medial border. On the upper 1/4 of the bone, the medial border is present just beside the anterior border, and it is below 1 millimeter in distance with the anterior border. So while running downwards, we can see the distance between the anterior and the medial border are increasing. The distance is increasing now. And the medial border, it terminates in the, this is the medial border. The medial border, it terminates in the roughened part of the lateral malleolus. This is the middle part of the lateral malleolus, the middle surface of the lateral malleolus, which is rough in nature, and this middle part of the lateral malleolus or the middle surface of the lateral malleolus, it articulates with the lateral end of the tibia bone. So over here, the medial border of the fibula bone, it terminates. You got it now?
तो मैं बोल रही हूँ देखो यहाँ पे भी बॉर्डर है, यहाँ पे भी बॉर्डर है, तो फिर
I am coming to them. Now the posterior border. Now the posterior border. The posterior border, it takes origin or it starts from the styloid process of the fibula. The posterior border always starts from the styloid process. This is the styloid process that is present in the head, on the posterior aspect of the head. And from the styloid process, the posterior border starts. The posterior border is always smooth and rounded. The posterior border is always smooth and rounded. And the posterior border runs downwards, and it terminates in the posterior aspect, in the posterior part of the groove, that is also known as the malleolar fossa. The posterior border, this is the posterior border starting from the styloid process. It is rounded, and the posterior border, it terminates in the groove that is known as the malleolar fossa. You got it now? Now, the three surfaces. This is known as the medial crest. I will tell you about the medial crest later. Now the three surfaces.
फिर भी एक लाइन रह गई ना.
Now three surfaces. Between the anterior and the medial border, this is known as the medial surface. Between the anterior and the medial border is known as the medial surface. Between the anterior and the posterior border is known as the lateral surface. This is the anterior border and this is the posterior border, and between them the surface is present is known as the lateral surface of fibula. You are getting now? And between the interosseous or the medial border, between the medial border and the posterior border, the surface that is present is known as the posterior surface. In posterior surface, we have one more line, and that is known as the medial crest or the vertical ridge. This vertical ridge or the medial crest is a part of the posterior surface. This is a vertical ridge. This does not form any border. This is just a ridge present in the posterior part of the posterior surface of the fibula bone. Now the muscle attachment. In the medial surface, we have three muscles: extensor digitorum longus, extensor hallucis longus, and peroneus tertius. These three muscles, they are present in the medial surface of the fibula bone. In the upper part of the bone, upper 2/4 of the bone, extensor digitorum longus is present, and below to it, extensor hallucis longus is present, and peroneus tertius is present posteriorly in the medial border, in the medial surface. Okay, so these three muscles are present in the medial surface: extensor digitorum longus, extensor hallucis longus, and peroneus tertius. Now muscle attachment in the lateral surface. Between the anterior border and the posterior border, the surface that is present is known as lateral surface. In the lateral surface, we have two muscles, peroneus longus in the upper 2/4 of the bone and peroneus brevis in the lower 2/4 of the bone. Okay, and between the posterior border and the medial crest, in the posterior surface of the tibia is divided into two parts. Between the posterior border and the medial crest, we have two muscles, the soleus and the flexor hallucis longus. So these two muscles, they get origin from the posterior surface between the posterior border and the medial crest. And between the medial crest and the medial border, the groove that is present between the medial crest and the medial border, one muscle gets origin that is known as tibialis posterior. In the head of the fibula bone, bicep femoris muscle, it gets inserted. The biggest clinical anatomy of fibula is the fibula bone. It helps in bone grafting. The fibula bone is mainly supplied by the peroneal artery and it enters the bone from the posterior surface. The common peroneal nerve that supply the fibula bone, if the common peroneal nerve gets injured during any fracture of the fibula bone, then the patient will develop foot drop. The fibula bone does not carry weight of her body, so it is also used in bone grafting. The upper and the lower end of the fibula, the upper end and the lower end of the fibula, they both are subcutaneous. We can palpate them. So thank you so much. This is all about the fibula bone.
Thank you.